So when it comes to the allergy part of things, if you say, hey, listen, every season, when grass season comes, my eyes itch, my throat gets a little tight, and I'm sneezing all the time, well, I might have you take grass homeopathic. They're homeopathic remedies that you can spray under your tongue. They will immediately neutralize you. You might have to do it a half a dozen times a day for 3 or 4 weeks to get you out of the acute phase. But then we're also going to look at, well, can we solve this? Can this be solved so next season it doesn't happen? Well, that's where getting your liver and gut working better plays an important role. And also a therapy that was developed in the 1960s in Britain called low-dose allergy therapy. And this is taking almost homeopathic doses of the substances that you're reactive to and injecting them under the skin, subcutaneous. But actually, when you get on the steroid pathway and bronchial, like using medications to dilate your bronchial tubes, you get on this kind of chronic drug pathway that actually depresses your immune system, disrupts your gut microbiome, and makes you more prone to the next kind of reaction that takes place. I mean, these medications are not innocuous. They have to be metabolized, particularly by your gut and your liver and your kidney. And when you get exposed to these substances on a repetitive basis, you get a failure to detoxify, where your liver goes, yeah, you have to go beyond the traditional medical thing. So, listen, I'm a family doctor. We run blood tests like Chem25. There's tests, liver tests called AST and ALT. Most of the doctors and patients are familiar with these. So, you may have chronic asthma, chronic eczema, and, you do blood tests and you do skin scratch tests and everything looks completely normal. So you assume that your liver's normal. But the problem is the liver is involved with phase 1, phase 2, phase 3 detoxification. Unless you're testing phase 1, phase 2, and phase 3 for functional medicine tests, you've missed it, which means that in the conventional medical system, you're then put into a category, like I mentioned earlier, of having psychosomatic illness. This becomes a mental health problem. That you need antidepressants, anti-anxiety drugs. You learn to live with it. It's stress in your life, and everybody kind of buys into that nonsense that goes on day in and day out in medical practices. The reality is that you have to look at what's going on with my liver.